Good afternoon, everyone. I have read your professional practice model assignments and given you feedback in your rubric and on your paper related to your work. If this assignment felt daunting, please know that's reasonable. This is a complex assignment. There's a reason that it is done during week 6, not during week 1 or 2. The idea with this assignment isn't just for you to explore the concept of what a professional practice model would look like and the value they have in guiding our practice as nurses, but also for you to venture into a more complex component of professional writing. So if you navigated the analysis of the concept of the professional practice model and you're able to pull some basic concepts that supported your professional practice model, and you used good writing practice and used references that were scholarly to support your ideas, that's a positive first step. Another complex writing component of this week was the analysis of evaluations of professional practice models. You were asked to get 2 to 3 articles and look and see what the literature said about using a professional practice model and how you would evaluate that effectively to see if your professional practice model did what you said it was going to do in guiding practice. What were the outcomes like? And then to take that one step further and take what you learned from that analysis and be able to apply it to your own practice. That kind of synthesis is a baby step in the direction of really creating a highly synthesized concept analysis for a paper. As you move forward into the program, especially as you move through the practicum courses, that ability to read information and synthesize it for its value, meaning, and context, and then apply it to your own professional position or circumstance or situation is a pretty scholarly behavior that we're trying to help you develop. The other piece of this is just the structure of navigating a more complex APA formatting. This paper really lent itself to using multiple levels of headings because of the granular or more narrow topic design. So this paper, if done really well, had level 1, level 2, and level 3 headings, and many of you did that really well. Your classmate Jaslyn rocked it out and put all 4 levels of heading and used the perfect formatting and style and structure for that. And that really is a very scholarly way to organize your writing, not only for your own organization, but also to guide your reader. So the more skill you get at using the APA level formatting, the more clear your writing and your sections and your paragraphs can be to make sure first that you're covering all the things you want to cover, but also that you've addressed the areas in the rubric and it's clear to your reader. Think about this if you were turning in a manuscript to a publication and you wanted to organize your manuscript in a way that guided the audience that read that journal. You'd be very clear about putting clear headings that helped the person that was reading that article that you wrote know what to expect in that section. And that's really the purpose of well-developed headings. The other APA piece that was tucked into this assignment to help you develop the skill was the use of inserting an appendix or inserting a figure. That has a very specific format that APA requires you to use for professional structure. The other thing that was tucked into this was the skill of using your chart design or your directional arrows or your special shapes, depending on how what your software titles it, in creating a chart or your professional practice model schematic. Some of you chose to use some very basic models, a few circles and a few arrows. That's okay. Some of you got more creative and did a really nice job of using squares and triangles and directional arrows, and really did a very complex job of providing a detailed professional schematic. And so this, again, embedded in this assignment was that skill of being able to go into Word and using those components of your software to develop a professional chart or graph or figure, and then use the APA formatting professionally to properly title and frame that inserted figure or schematic or appendix. If this felt challenging, again, know that it was challenging. It was designed to really make you think about using the professional practice model as your topic, but really expanding on that idea and developing something that was relevant to your own practice. If this was not your best work, if this was really tough and you struggled, guys, that's okay. This is part of learning. Some things are just going to be more difficult for a variety of reasons. So just know that there was intention in the design, there's intention in the added development of your professional writing, and that if there were things in this paper that didn't go real well for you, that's okay. I want you to take the feedback that's been provided and think, how can I use this so the next time I see this expectation to do a synthesis, or I see the expectation that I need to insert a figure of some sort or a table or a chart, that I'll know that there's a way to do it that I'm improving. So be gentle with yourself if this wasn't the best outcome. Huge yay for anybody that slam dunked it and did really well. Lots of you did really well with this assignment, so I'm pleased with this. I also know that when I grade this assignment that this is really tough. So know that I appreciate the efforts wherever they landed on the spectrum. Know that if you have questions or concerns, you want to talk about this or anything else, you feel free to send me an email, and we'll set up a time to have a phone conversation if that's supportive of you in any way. You're gonna this week you have got 2 assignments. First is the discussion board that is pretty straightforward, and my hope is that this kind of lets you catch your breath from the dauntingness of this week. Your discussion board is talking about your calling to nursing. The only thing I'll caution you to do is make sure that you use some Bible support, some biblical references to support your experience. I believe your assignment requires you to use 2. That's sufficient for this assignment. This really is just to have you share your story and be able to share that in a meaningful way with your peers with the biblical underpinning that's thoughtfully applied. The other part of your assignment is to look at your quality of, let's see, yep, it's quality control issues. Making sure I have the title right. You're asked to come up with and explore 5 nurse-sensitive indicators that relate to improved patient outcomes. Most of you guys are going to do fine in picking out 5 things that are nurse sensitive that we do in the hospital that you have influence over that positively impact patient outcomes. The challenge that I often see students do with this assignment is they get so excited about the 5 patient outcomes that they forget to tell me how you're going to measure them. So, and that's a component of this assignment. So talk about the 5 components of quality care that you want to discuss. It's entirely up to you whether you want to take a bedside nurse leader focus and look at infection rates or patient falls, or if you want to take a more global approach and look at communication, or medication reconciliation, conflict resolution. There's all sorts of things that we do in the hospital setting that impact patient outcomes. So you can take a bedside approach from a bedside nurse leader approach to be very practical. You can take more of a bird's eye approach and look at it from an executive leadership position. Leadership, even though it's not at the bedside, using sterile technique and cleaning everything and the things that we think about direct patient care, we know that the culture and leadership positively and can negatively influence patient outcomes. So however you want to take it, it's entirely up to you. Be sure that they are nurse sensitive. Make sure that you explain how they're nurse sensitive. Bolstering your work with scholarly support, some kind of literature support from your book or author or articles is a really good idea to substantiate what you said. It would not be scholarly writing to make a list of 5 things that you think are great ideas and not support those ideas with scholarly support, because that's it is a research paper, so there should be some research in it to support your ideas. And then tell me how you're going to measure it. How are you going to know if you are focusing on these? How do you measure if you're doing this well, if you're not doing this well, if you're missing the mark? And remember that we sometimes measure things in a quantitative, the number of things we do, or a qualitative outcome, which is more thematic in focus. However you want to measure it, I don't care. I just want you to think about, how am I going to know if I'm doing this right, and be able to address that in a supported way in your paper. Again, this paper is a little bit more complex. Use your level headings. So make sure that you're using at least level 1 and level 2. Some of you, if you do a more of a detailed focus, can use level 3. Just be sure you're doing it. Okay, I think that's it. Let's check in my notes. Yep, I think we're good. It is Wednesday, about 2 o'clock here in Roanoke. So I'm around. If you have questions or concerns, you want to talk about your assignments, you want to talk about your progression in the course, please know that I'm here. If you have general questions, again, the who, what, where, when, how kinds of questions, use the Ask the Professor link. That's a really effective way to ask questions that your peers are likely wondering. Anything personal related to your grade or your own performance, feel free to email me. You'll find that I'm fairly responsive with both venues of communication. Just be in touch. Let me know how you are, and let me know how I can first pray for you, and second, support you in your wrapping up of this course. You have 2 more weeks, and then you will be on to summer. No, I guess it's spring D. I had to think where we were in the calendar. I hope you guys are having a great week. Take care.